Hi there. My name is JoAnne Arcand, and I'm an associate professor and public health nutrition researcher at Ontario Tech University. Over the past 20 years, my research has focused on examining strategies to support dietary sodium reduction. We have very strong evidence that eating too much sodium raises blood pressure and increases a person's risk of developing heart disease, stroke, and chronic kidney disease. And the challenge lies in the fact that Canadians and people around the world are consuming almost twice the recommended amount of sodium, which is significantly increasing their risk for these adverse health outcomes. The majority of individuals in Canada are consuming their sodium from packaged and processed foods, meaning that this is the sodium that food manufacturers have added to their food products. And so, because most of the sodium is coming from these sources, one of the most effective public health strategies that we can implement to support sodium reduction are setting limits for the amount of sodium that can be added to these food products. In 2010, the Government of Canada published a sodium reduction strategy for Canada. And as part of the strategy, they published a set of voluntary sodium reduction targets that were designed to guide the food industry in limiting the amount of sodium that they're adding to processed foods. Now, what we've shown in our research is that very little progress has been made in taking this voluntary approach. So what we've seen over the past decade that as a whole, sodium levels have not significantly changed, that only a few food categories have made any meaningful difference in the amount of sodium in their food products, with over 60% not meeting any of the sodium targets at all. And this makes it very unlikely that Canadians are benefiting from this approach, meaning the voluntary approach is not working. In contrast, if we look at taking a mandatory approach, which means requiring the food industry by law to reduce the amount of sodium in their packaged foods, recent data in Canada shows that this could save our economy $4.2 billion and reduce the amount of, or prevent rather, the amount of heart attacks by almost 220,000 and the number of strokes by 164,000. So this is very important from sort of an economic perspective when we think about the number of healthcare dollars that can be saved. But when Canadians think about this on a very personal level, it can have significant impacts. It means that our friends and family are not going to be traumatized by having a heart attack or a stroke, that we will reduce the amount of grief people have by losing a loved one too soon, and that we can improve overall quality of life by minimizing the daily struggles that are associated with living with a chronic disease. And so to protect Canadians, it's clear that we need to do a lot more and that we can do more if we would choose to do it. So the Global Health Advocacy Incubator position paper that has just been published outlines some best practices for how we can support dietary sodium reduction using food reformulation, meaning reducing the sodium content of packaged foods. And I wanted to highlight two of their recommendations here today. The first is to set mandatory sodium limits. So we need to enact laws in Canada to require the food industry to lower the sodium content of the foods they are producing in some key categories, food categories where Canadians are obtaining the most sodium in their diet. And this would mean that Canadians would benefit without having to significantly change their actual behaviors. And so this is a very equitable approach to enabling dietary sodium reduction at the population level. The second, to complement these mandatory sodium limits, would be to establish an independent monitoring and enforcement program. And this would include conducting planned periodic assessments of the sodium content of foods by an independent body, such as Health Canada, and to make the results of this monitoring program public so that Canadians can be made aware of the successes and the progress that the food industry is making towards sodium reduction. Taking these steps, meaning setting mandatory limits and ways to monitor the progress that a country is making, has been seen in other countries like Argentina and South Africa. And these countries have seen significant benefits from setting mandatory sodium reduction targets. And Canada now needs to reflect on their opportunity to do the same and to have policy leadership in this area with other countries at a global level. And so I'm calling on us, decision makers, researchers, to really advocate this Sodium Awareness Week to move past awareness and towards greater action in lowering the amount of sodium that people in Canada as well as around the world are eating, so that we can achieve better population health outcomes. And this includes setting mandatory targets now, and not in the future, because the future has arrived and we have a better opportunity to promote public health. Thank you.